Hi everybody, here we are again at San Antonio Cosmetic Surgery. I'm Dr. Baumholtz. This is Nicole.
Hi.
Cynthia, our nurse injector, and the rest of the team is here. This is kind of an informal day, but we want to talk to you about an exciting new product called Kybella. Kybella is a derivative of a naturally occurring enzyme. It's the kind of enzyme that we have in our body that helps dissolve fat. In this case, we want to dissolve the fat under the chin. So if you have this persistent little waddle, you have a persistent little waddle?
Yes.
Persistent little waddle that a lot of us have, we can treat it very successfully with this product called Kybella. You're going to hear more about Kybella in the coming weeks and months as the company advertises it more and more. We have it here at San Antonio Cosmetic Surgery. I'll give you some demographics. We are at Westover Hills. Our phone number 210-614-4320. There are lots of ways to treat under chin fat. I'm going to show you one that works really well for us. Now, some things about Kybella. Kybella is an injection treatment, so there are needles involved. There are small needles, but there are still needles involved. It typically involves 2 to 3 treatments, separated about 6 weeks apart. So we'll do one today, and we will do another one in about 6 weeks, and another one 6 weeks later, and today is your second treatment. Now, this fun thing that she's holding under her neck, it is a really fancy San Antonio Cosmetic Surgery invention. No, it's actually a water balloon that we froze, and it's working as a fabulous ice pack that she's holding. Now, let's look at the side of her profile, and you see some lines and drawings that are already done. And so what I'm going to show you in just a moment is how we prepare someone for Kybella treatment. So, come on over here, let's look at the pictures. So again, this is before the first treatment. Here's the side view, the oblique view, and then another oblique view and the other side view. Okay.
And how long ago was this one done, doctor, this first picture?
About 6 to 8 weeks.
6 to 8 weeks. This is before Kybella, and this is her profile now with one treatment.
So we can see a dramatic improvement. All right, so let's pretend you don't see all those fun dots, and I will explain what all we're looking at. So, a patient comes, and here I'm going to come to this side. We're dancing behind each other. Hope you all can hear me. Thank you, thank you, thank you. Okay, so now, hi.
Hi, sir.
So typically we meet. This is a procedure, so we're going to ask some medical history questions. We're not going to do that today, but we've already done it. Next. How much Kybella do we need? Well, this device helps make it as easy as possible. This is the gridding system. With the help of a simple wax pencil, what we do is we're going to identify some anatomic landmarks to keep us out of trouble. Some people do all of it, so I've done all of it just to show, but here we have the anterior border of the sternocleidomastoid, the thyroid, the hyoid, and then the border of the mandible out here in white. Then what we do is we take this gridding system, place it on the patient, and wet it, and it transfers the dots like a temporary tattoo. Temporary being the key word. Okay. Next thing, we have a patient ice for about 10-15 minutes. Please ice. Through the magic of the internet, it's been 15 minutes, like a cooking show. We're able to take it right out of the oven, and it's done. Ta-da! Okay. Yes. I was like, I already do. Don't forget to like and share this video. What's the opportunity this week? Wow, really? Okay, so for one free, this is like the ShamWow commercial. Am I allowed to say that? Are we gonna
You can say that.
The copyright people are gonna. So please like and share the video for an opportunity to win one free Kybella treatment.
The value of that, doctor, is?
A lot. What's the value of one Kybella treatment? Tell us.
Anywhere between $12,000 to $3,000.
So you meant 1,200 to 3,000. Yes. So from 1,200 to $3 grand for a Kybella treatment. No, you can't sell this. Okay.
The other thing is, if you have any questions, please feel free as we're doing the treatment to ask them, like us, and then ask the questions. We'll answer anything you have. You're the candidate. We'll talk to you about it, whether this is a treatment for you, whether it's mini cool sculpt in the area. All these things will be answered for you when you come in for your consultation with Dr. Baumholtz or Dr. Ortegon.
Right, so my partner and I, Dr. Ortegon, who's not with us today, he's operating. So you can come and have any one of 3 experts do this. Dr. Ortegon, my partner, myself, or Cynthia, our nurse injector, we're all qualified to do this, and we're all happy to help you.
We have one lovely question. How long does the treatment last? Is this permanent fat removal?
Yes. So as long as you put down the Krispy Kremes, it is permanent. So if you're like me and you continue to, not eat well and exercise, like all the ladies in the office exercise, I should take a lesson from them. But as long as you make it part of your overall health plan, it is permanent.
Excellent.
So now, based on the number of dots that we have in the treatment area, we've determined that Nicole will need about 5.5 cc's to treat her. And we're going to get started. I'm going to do half, and Miss Cynthia's going to do the other half, and you're going to see how quickly it goes.
Nicole, the question from the audience, they want to know if it was painful the first time.
No. You basically will feel just a slight burning sensation, but the area goes numb after being injected.
So now, one of the things that, and I'm going to say this because I believe that informed consumers are our best consumers and our patients, is that the company will say that there's 0 downtime, 0 swelling, and 0 bruising. And so here's what I want to say about that. I'm going to use a needle to place a product. By definition, there is the risk for swelling and bruising, right? The product does cause swelling. The swelling lasts typically 10 days has been the average across the board of both our male and female patients. We do see more and more male patients get this treatment done, as it is a nice, easy way to come on your lunch hour, be treated, and be back to work. And so we're talking a little bit because you'll see the actual treatment goes quite quickly once we get started. So from the time somebody comes into the office to get them out the door should be around 10 minutes to get this treatment. Okay?
Can you go back to work?
We ask people, I don't want you to drink heavily tonight, and I don't want you to work out heavily tonight, but by tomorrow you're back to whatever you can tolerate. Okay?
Okay.
So should we get to the getting?
Yes.
Awesome. So I'm going to steal this away from you for just a moment. If we have young viewers, they might want to look away. Kidding. So I'm going to just put this towel here for just a second. We want to protect your clothes. Now, what I'm going to do is I'm going to adjust the bed. No. Okay, just give us a second. I'm going to adjust the bed so that we can all see. Yeah, okay. And then what we're going to do is we're going to make the light, we're going to turn the light on. It's going to wash out the rest of us, but hopefully it'll let you guys at home see what's going on. Let me get this set for us. So, we're going to turn the light on. We're going to see how it looks. Make sure that you guys can all see what we're doing. So, for the viewers at home, is that easier? Can we all see a little better?
You see all the little dots, the grid he's made where he's going to go?
They want to know what the difference is between the red and the blue dots.
No difference at all. It just they could all be the same color. I guess the company decided to have a little pizzazz with it.
Got it.
It is a plastic surgery office after all. Okay, we ready to go? So I'm going to steal the first syringe. I'll take one of the alcohol swabs, if you please.
Sorry.
Yep. Awesome. Okay, so keep your chin up. So the treatment area, again, is between this line, the angle of her mandible, and this line. So this grid here. And I'm going to just touch her with some alcohol as we go across. I don't want to wipe off my dots that we painstakingly placed. I'm going to place that here. And so we're going to get started. All right, Nicole, you ready to begin? And I'm going to check that I've got
Yes.
1 cc worth. And so here we are. I'm going to do it a little bit differently than I normally would. So we're going to go just under the skin, and we're going to place 2/10 of a cc and 2/10 of a cc.
How are you feeling, Nicole?
And 2/10 of a cc,
As you can see, he's going pretty fast.
2/10 of a
She's
cc,
not even flinching. She's doing
2/10
great.
of a cc. I'll trade you for the next. Thank you, my dear. This is like the pit crew at Indy.
Even better.
Even better, yeah. The pit crew at Indy should look this good. Okay, here we are.
Don't forget to like us. Call our office, 210-614-4320 for a free consultation.
How you doing, honey?
Good.
Here's your thumb.
She will still go back to working after this. We have patients to see, consults to see, cool sculpt for her to do, and
There's no way.
she's a champ.
There's no way we're letting you go home. Yeah, right.
No, none of this excuse. She's doing great.
Okay. Great. And now Cynthia's going to pick up on her side, starting at this dot.
Question, doctor, from the audience. They want to know if you anticipate Nicole needing another treatment after this, since this is her second treatment.
We're going to wait and see. We'll have her back in 6 weeks, and we'll see if she. The bottom line is, if she's happy, we're happy. That's a great question, though.
How are you doing, Nicole?
I'm doing good.
Awesome.
Try to stay away from the dots so I don't tattoo her.
Yep, we want to go just next to the dots. You don't actually want to go through the dots. Good. Perfect. Perfect. Awesome. Blot. Okay. Now, we're done.
Wow.
She survived.
You okay, Nicole?
And
How'd
so
that
then
go?
all we're going to
I'm
do is we're going to take this. She's going to hold that. I'm going to turn the lights back off. And we're done.
Are you happy with your results, Nicole?
Yes, I am.
It looks great.
Could you imagine a more fabulous place to work than San Antonio?
I love working here.
Nice, nice. The check's in the mail. No. That was Kybella. Again, under chin fat. And some questions that might come up, which I'll answer, some questions that have come from our patients is, does it produce some skin tightening? So the answer is variably yes, because as it empties out the fat, it does produce some skin tightening. But again, the idea is to get rid of this waddle. Is it permanent? We asked this already. The answer is yes, as long as we watch our weight and what we eat. That took us, even with us talking as we did it, it's not people are calling, they want to know how they can get an appointment to see Kybella or to have treatment by Kybella. Lots of people treat with Kybella. Are all of them nurses and doctors? Probably not. No. So when you go, wherever you may go, if you've decided not to come to our fabulous facility here at San Antonio Cosmetic Surgery, be mindful that you're going to a place that has board-certified plastic surgeons and certified skilled nurse injectors like we have here.
Get a consultation, get an overview of what you really need and what you're looking. Make sure you're a good candidate. Take pictures, see pictures. We like to really engage with our patients. Go into our websites, get a little background on us. Patients are, it's like a family here. We want to make you feel comfortable. It's not about pushing any product on you. It's basically about educating you. As you can see, Dr. Baumholz with his patients love to spend the time educating them, letting them know what their options are. Dr. Ortegon, same thing. We want to make this experience a pleasant one.
Who makes Kybella? They want to know if this is the same maker as Botox and Juvederm.
Yep.
That's right.
And if you accept brilliant distinction points.
Yes.
Yes, it's all included. We're also very proud to say account, which means we do a lot of Botox, Juvederm, Voluma, breast implants. It's a one big family corporation. You bring your brilliant distinctions, we will give you the points. We will honor them. We'll always do all the work for you when you come in the office. The girls up front are more than happy to look up your account, bring you the points, print up the coupon, do all the legwork for you. That's what we're here for.
Are you running any promotions right now on this Kybella treatment?
Yes, you can call the office and the girls up front will be able to tell you what specials we have. Free consultations for sure when you come in. At that time, we'll give you a package of what is required for you. At that time, we'll break down the pricing and tell you what is the best option for you with the courtesy of your treatment.
And this month only, we're running a breast augmentation special. If you buy the left side, you get the right side for free.
Cute.
Oh, God.
And what's the phone number here again?
210-614-4320.
And remember, we still have our special for our Juvederm and our Voluma. It went very well about 2 weeks ago, so I still have lots of patients calling. $200 off your Voluma treatment, $200 off your Juvederm treatment, so it's out for the next a little bit. In another 2 weeks it'll be over. All our men, this is also a great procedure for men. A lot of you men that are out there looking at us, we love doing the Kybella on men. Men do extremely well. My boss over here will someday let me touch him. He's still like, I don't need it, but we've got a lot of male patients. They are the ones that are great. Why? Because you guys can really hide this with your beard. Once we treat you, it grows out. You know, you can't even tell. We've done really nice job where it contours and chisels you, and the downtime is nothing. Most of you men don't want to go under the knife. You don't want to have anesthesia. You want to keep working. This is a perfect treatment for you. Please give us a call and we'll talk to you about it. 210-614-4320.
Okay, from
Thank
everybody
you so
here at
much.
San Antonio Cosmetic Surgery, hope to see you guys soon. Have a great afternoon.
Thank you.
Bye. Have a good
Bye.
one.